you very much. My name is Junji Wakui. I am in charge of water and sanitation in Tokyo. And we, JICA, joined SuSanA very recently, and we are newcomer. So I'd like to explain about what we are discussing among us and what we are going to do in the regard of sanitation and hygiene and the new project in Senegal. First one is the fact that the implementation of Japan's ODA on water and sanitation. Sorry, the statistics is a little bit old, but tendency is the same. Japan has been the world's largest donor in the water and sanitation sector since the late 1990s. And Japan has implemented 7 billion of ODA in the 5 years between 2003 and 2007, which account for 30% of the bilateral donors total. And this graph shows the tendency from 2003 to 2007. And first, this line blue, Japan. Next is United States, Germany, and Netherlands, France, and so on. And this is the proportion of the ODA commitment basis. And Japan occupied more than 30% of ODA from this period. Of course, the tendency is the same. But of course, this is for all over the world, including Africa. In African countries, JICA has conducted many water supply and sanitation projects as well, but mainly focused on the water supply so far. And the water supply project consists of construction of water supply facilities and enhancement of O&M mainly, and less attention to sanitation and hygiene so far. But UN made a resolution on sanitation, sustainable sanitation, which is called 5-year drive to 2005 last year. And surprisingly, Japan is one of the proposers of this resolution. And as a governmental organization, JICA needs to scale up ground level action as well. Of course, not only because of this, but also, of course, we are more aware about the importance of sanitation and hygiene. As I told you, JICA joined SuSanA last year newly, and we expect its network and also the knowledge know-how. And inside of Japan, we have to start from the very beginning. We have to start from increasing the number of our experts inside of Japan. Therefore, we are preparing publication of the Japanese version of WHO's first step-by-step guide and the textbook of CLTS. I think they are very famous. And also, we made teaching materials for distance technical cooperation through internet, which is called JICANet. And the languages which are used are Japanese, English, and French. Actually, these two materials are for our practitioners, such as our volunteers, experts who are working in African countries, also our staff in African offices. And especially these teaching materials are including a very basic of sanitation and hygiene concept and so on. Therefore, it may be able to be used for other people. So we now, this teaching material is available on the net. If you can access this one, you can watch this teaching materials through the internet. And also, we made clear mentioning about sanitation and hygiene in the JICA thematic guideline to water resources, which is our strategic paper of the sector. So far, it didn't mention clearly about sanitation and hygiene, but we modified it last year as well. And of course, it is very important to do the real work on the ground. Therefore, we consider to start a new sanitation and hygiene promotion project as a basis of scaling up in Senegal. In Senegal, government, why we selected Senegal? That of course, government sanitation access target, which is 60% in 2015, is unlikely to be achieved. Actually, currently, it is only 30% in 2010. And also, there are several regions like here, very low coverage of hygiene and sanitation. And for example, in Tambacounda here, it is only 25%. Matam here is 14%, and Kedougou here is only 5% compared to the national average of 40%. And actually, the water coverage in these regions are also very low. Therefore, we have been focusing on our water supply project in these 3 regions recently. Therefore, we had lots of experience in these areas, long history of operation. That's why we selected these areas, regions, for our new project. This is about the new project, which is last 4 years and already started in March 2012. And actually, JICA's first project focusing on sanitation and hygiene in rural areas. And budget is around $4 million US dollars for 4 years. And the target areas, selected villages in 3 regions of Tambacounda, Matam, and Kedougou, as I told you. And usually in any countries, sanitation and hygiene are controlled by many organizations and institutions. Therefore, in this project as well, we included several governmental institutes like this from the Ministry of Health and Sanitation, Hygiene and Prevention, as well as the Ministry of Urbanizing and Sanitation. The next is project approach. There are 2 projected approaches. I think these are very basic of this kind of project, but first one is behavior change. We aim at end of open defecation and establishment of hand washing and other hygiene practices through CLTS, etc., etc. And in the regulation of Senegal, the villages which can achieve this end of open defecation can declare these villages achieve the total sanitation. And after achieving this total sanitation, we go to the next step to increase the access of improved sanitation facilities, which is promotion of the facilities through social marketing, establishment of mechanisms for facility construction, and from bridging here to here is, I think, one of the key and important point for implementing this project, and providing continuous motivation for improving sanitation and hygiene for the people is, I think, also very important. And what we want to achieve in this project is to construct more than 2,000 improved flatbed in these 3 areas. Of course, this is depending on how this project is going well. Selection of target villages, starting from around 15 villages in 3 regions as pilot, and then scaling up. And there are 2 categories of villages. And first one is villages with open defecation is still being practiced. And for this category villages, we have to start from the very beginning of sanitation hygiene aspect. Next one is villages declared total sanitation already, possibly with other development partners CLTS support. And for this category of villages, we can start for activities to upgrade the sanitation facilities. And also capacity development, regional level administration and coordination with other actors is important. Therefore, we included some technical assistance for the institutions like the ones which are listed here. And for this, under the Ministry of Sanitation, we enhance the capacity for conducting field tests by themselves. And for this regional service of sanitation, we would like to enhance the capacity to implement supervision of the social marketing and battering construction. And we are also utilizing the regional platform for oral sanitation and hygiene, which is supposed to be established in each areas. Currently, only Tambacounda has this platform, so we are going to establish this one in other two regions. And this is the example of the targeted villages.
1 minute.
Okay. And this one is now under some activities of CLTS, and this house has already constructed very basic toilet by the materials which are available easily in the villages, and hand washing and so on. These activities are already started, and after the completion of the total sanitation, we go to the next step. This is the villages which are already achieved the total sanitation. We are going to start upgrading of this kind of project according to the sanitation levels. And of course, this work cannot be done only by JICA. Therefore, the cooperation with NGOs and making using the know-how is very important. This is one example of the activities of NGOs. We are now trying to include this kind of NGOs in our project as well. And the next step, of course, as I told you, this is the new and first project for us. Therefore, we would like to analyze the outcomes and feedback to our another project. Also, we want to share the lesson learned from this project with other SuSanA network institutions as well. And also, next one is scaling up to the other countries, and also collaboration with other DPs should be considered. Currently, JICA has MOU with GIZ in the collaboration of water supply and sanitation sector in Sub-Saharan Africa. And we are now doing lots of things in the countries such as Burkina Faso, Zambia, Tanzania, Kenya. We are working together in the water supply sector, so I think we can utilize this one as well. Thank you very much for your kind attention.